Hi, good evening. Today we will to update the coronavirus. What is the affecting in the world? So I just like to have a little description on this. So we'll have starting with the US, like more than 200,000 people are affecting from this the corona, and Italy it's like 100,000 people are affecting, like Spain also 100,000. So it's like total more than 900,000 are affected in the corona. So today as of today its deaths cases are like around 50,000 peoples are deaths. So we like to have the BBC News what they're saying, the how the corona is affecting in the world and UK and Europe.
Another rise in the number of people who have died from coronavirus in the UK as the government warned that this invisible killer is the biggest threat our country has faced in decades and that worse is to come. 563 patients have lost their lives in the past 24 hours, taking the total number of deaths in hospitals to 2,352 in less than 4 weeks. The latest increase in deaths is sadly in line with scientific predictions. Most of the cases are in London, but NHS England says the threat is everywhere, and the growing number of hospital admissions in the Midlands is now a cause for concern. Today it was confirmed that a 68-year-old semi-retired doctor in Hertfordshire has become the fourth doctor to die. Here's our political editor, Laura Koonsberg.
Hilda Churchill, who lived through a pandemic a century ago, the oldest victim at 108. Dr. Ardil El-Tuyar, the first medic to pass away. Doreen Hunt, a grandmother who died on Mothering Sunday. As coronavirus has taken hold, just some of the faces of its early victims. But as the numbers grow, more families lose mothers, daughters, fathers and sons. And one of the latest, the fourth medic to lose his life, Dr. Alpha Sadhu, who'd returned to work to help. This is his son.
So we said our goodbyes and we just told him to fight for us. And then the next 24 hours, 40 hours, his body just deteriorated. What they told us, his body shut down, he had organ failure, and he just couldn't fight anymore. I massively admire the people at the NHS and the job that they're doing, because it's no joke. This is a serious virus and people are risking their lives to save people out there.
A message repeated by the government today.
All our thoughts and prayers are with the families and loved ones of those who have lost their lives. This is more tragic evidence that this virus does not discriminate.
Look at how the numbers have grown from the first counted on the 6th of March. 8 days later, the daily toll reached double figures. 20 days from the beginning, that figure reached over 100. Now, less than a week later, more than 500 people recorded to have passed away in 24 hours. The overall count, 2,352.
The peak of this disease seems to be coming earlier than the government expected, but you are missing the testing targets. There's a huge amount of evidence of staff not having the equipment they desperately need. There are not enough ventilators. Do you accept now that the approach and the response from government has just been too slow?
Increasing testing capacity is absolutely the government's top priority. We're now at 10,000 tests a day. We're rolling out additional networks of labs and testing sites. And in terms of PHE, over the last 2 weeks, 390 million products have been distributed. And of course, we will continue to do more.
There's evidence too that people are taking to the roads again, flouting the stay-at-home advice. There are frantic efforts underway to make space for those falling ill. The army moving in to help in Cumbria tonight. In Belfast, in Glasgow, in Cardiff and around the country, hospitals being created out of conference centres in just a matter of weeks. But the broad political consensus that's backed the government's approach is starting to fray.
So what we're really calling for now is a national testing strategy, a strategy to ramp up the community testing and contact tracing, like we're seeing in other countries. That's how other countries have been able to beat this virus or get this virus under control and suppressed. We're not doing it yet, so we need that national plan.
A former minister and practicing GP says the government just hasn't moved fast enough.
We'd anticipated this as a risk. It's a tier 1 national security risk. That's in the public domain. does beg a belief that we didn't actually sort of act quicker because we knew, because we'd done an exercise, we knew that we had these challenges.
But no ordinary recovering patient, Prince Charles urges us all to stick together.
As a nation, we are faced by a profoundly challenging situation, which we are only too aware threatens the livelihoods, businesses, and welfare of millions of our fellow citizens. None of us can say when this will end, but end it will.
But a time of anxiety for our health and the country's wealth is a growing time of political pressure too. Laura Kunsberg, BBC News.
Nearly 1 million people have applied for universal credit benefits in the past fortnight. That's almost 10 times the usual number. Our economics editor Faisal Islam joins me now, and those are the 2 weeks since the Prime Minister told us all to stay at home. It really does underline the enormity of what has happened to people's livelihoods.
Yeah, it's a grim rise. It's sort of without precedent off the scale to get to 950,000 in that just over 2 week period. Typically in a 2 week period you'd get 100,000 new claimants of universal credit. And what it shows is the impact of their shutdown, but also that some of the government schemes, that there are gaps, and this is what will fill it. Now, the government will argue we have increased the generosity of universal credit, and they want people to claim this. They also argue that it shows that some of the early teething problems, in terms of this huge increase in the number of people applying for it, that they have been worked through, and that civil servants have done a Herculean job in getting nearly a million people registered. But it also, some of this will flow through into the jobless numbers too. What we don't know is how many companies will take up the option to sort of park their workers, furlough in the technical terms. That will affect the jobless numbers. Some are predicting the joblessness could double.
Faisal, thank you. The Health Secretary Matt Hancock has ordered any spare coronavirus tests to be used for NHS staff. Up until now, staff were only allowed to account for 15% of all testing, despite some hospitals reporting as many as a quarter of all doctors and nurses being off work in self-isolation. The UK can currently carry out more than 12,000 tests a day. Yesterday, just under 10,000 were conducted. The government is aiming to test 25,000 per day by the end of April. With more, here's our health editor, Hugh Pym.
NHS staff getting tested for coronavirus. It's a new pilot scheme in England run by the government, designed to speed up the process and get them back to work quickly if they've been self-isolating and need an all clear. But it's very limited at this stage.
I've been off work for around 4 days because I've been symptomatic. And my wife's been symptomatic as well.
Oh, I had 3 symptoms, very bad ones. So I'm due to come back to work on a Friday. So I thought before I come, I'm gonna get checked.
Almost all testing is analysed in hospital and public health laboratories, and there's a problem. They're struggling to keep up with the workload. Till this week they'd been told to only test patients. The representative of trusts in England told me a shortage of raw materials was a concern.
Everybody will be working as hard as they can to increase the number of staff tests, but we just need to remember there are some severe shortages of both swabs and reagents. So one trust said to me today that they've only got 3 swabs per day to test staff.
The first coronavirus cases in the UK were announced on the 31st of January. Testing of all recent contacts of cases was adopted. On the 11th of March, the government announced an aim of 10,000 tests a day. A week later, the Prime Minister said this would be more than doubled.
We will massively scale up our testing capacity in the weeks ahead so that we hit 25,000 tests a day.
By this time, testing was focused on NHS patients, not in the community. On the 19th of March, I asked the government's chief medical advisor why NHS staff weren't being tested.
The ability to test their staff, our staff, particularly if they've got mild symptoms that mean that they could normally go back to work, is absolutely critical.
But it wasn't until the 29th of March when hospitals in England were told to allocate 15% of testing to staff. Today they were told do as many as possible. By yesterday the number tested was still just below 10,000. And tonight the Prime Minister felt obliged to make a new pledge.
And I want to say a special word about testing because it is so important, and as I've said for weeks and weeks, this is the way through. This is how we will unlock the coronavirus puzzle. This is how we will defeat it in the end.
So I like to give you the message, guys. We have to safe from the corona, how will safe, stay at home and always take care for you and take care for your family and take care for all the society. So stay at home. If you don't have any urgent work or anything, so please don't go outside, and you should take I mean your community or at against the COVID-19. So thank you very much for watching this video. Thanks a lot again.